So good morning, everyone. I'm Gina Sadam. I'm the president of the Wyoming County Chamber of Commerce. Welcome today for our Restart, Rebound, Rebuild series. Today we are talking health and emergency services in Wyoming County. And we have on the line with us Anne-Marie Stevens, the CEO of Tyler Memorial Hospital, and Jean Daisy. I always mess up your last name. I'm sorry, Jean. The director of the Wyoming County Emergency Management Agency. So thank you both for joining us this morning. We appreciate it. And let's get started. First, just thank you both for your leadership and guidance through this. Anne-Marie, I hope you're well, and I hope your family's well. I know you do commute to us. And I appreciate that. Are your family as well, and things are going well for you on the home front?
Thank you very much, Gina. We're doing very well, and truly I appreciate the opportunity to participate in this call so we can share what we're doing here at Tyler to protect our patients and our community, and also assist with any questions anyone has on reopening of our community, because that's very important as well.
Great. So we're going to dig right in and get started. If you do have questions, you can type them into the chat. I do have about 10 or so questions prepared for each Anne-Marie and Jean. So as we go through, they will answer these questions, and then if we have time for more, we will get to those.
Gina, can you hear me at all?
Yep, Jean, I got you. Yep,
okay,
and I can see you now too. Yay.
Yay.
All right, so good morning. Jean, I hope you're well and your family's doing well. I know
Yes.
This has been a busy time for you.
Yes, everybody's doing well, and you're right, it's busy.
Yes, certainly. Certainly. So we'll get started with our questions this morning, and we'll kind of bounce back and forth a little bit, perhaps between the two of you, and questions to answer. So Anne-Marie, I'll start with you. And kind of first and foremost, is COVID-19 testing readily available at Tyler Hospital?
Yes, Gina, it is. We actually are doing our testing in the emergency department and our inpatient units. We screen all our patients for, based on the CDC and Pennsylvania Department of Health guidance. And the main symptoms that we're screening for is cough, shortness of breath, difficulty breathing, any fever over 100 degrees, chills, muscle pain, headache. That's changed a little bit recently. They've added some new criteria, so we're also expanding our testing based on that. And we've recently added patients who are in communal living, such as nursing homes or personal care homes, and persons who have a known exposure to the COVID virus, as well as healthcare providers. We also are taking in testing that some of our area physicians are doing in their office. We take those in at the hospital here, and then we process them and get them ready to send them to the Pennsylvania Department of Health or some private labs that are approved in Pennsylvania.
Okay, great. And you mentioned that there are some additional criteria right now. Can you tell us what that is?
Sure. What we've seen, especially on patients coming into our emergency room, the COVID virus, when it initially started, was basically respiratory symptoms. And now what we're seeing is expansion to GI symptoms, abdominal pain, nausea, vomiting, something as simple as lack of taste or smell. That's another red flag that, kind of guides us to whether patients need to be tested. Some patients actually, not the ones coming into the emergency room necessarily, but some patients just for informational purposes have no symptoms at all. So you really need to be sure to take the precautions for social distancing, use of masks, and hand washing especially. This is a droplet virus, so it's spread through, you could spread it through talking, singing, sneezing, coughing. That's why we ask people to wear masks, not necessarily to protect yourself, but to protect others if you're coughing or getting those droplets out there. And as well as cleaning surfaces. Once the droplets are out there, they can last on different surfaces types up to 1 to 2 days. So we need to make sure that that's being recognized as well.
Wow, thank you. Now, those tests that you're taking in at Tyler, are you performing them right there, or are they being sent out to the Department of Health? I'm sorry, I might have missed that.
That's okay. The tests themselves, we are actually collecting the tests right here in our laboratory, and we prepare them and get them sent out to either the Department of Health, that's what we started with, or the Department of Health then expanded that we could send them to private labs. So between the three of them, that's where we're getting our testing done. And initially, I know one of the concerns was the turnaround time. Initially, because I think there was a rapid influx of tests, our turnaround time to even get results from either the Department of Health or the reference labs was like anywhere from 7 to 10 days. So we needed to make sure patients were treated from their symptoms for that. Fortunately, the labs have responded to that, and as of the most recent testing, we can get our tests back within 24 to 48 hours.
Oh, great.
So that's much better.
Yes, and that was my next question. So how long does it take? 24 to 48 hours. That is very good news. Because
Right.
I think people were concerned, if the virus is, people are saying, if it takes 15 days or so to recover, well, if I don't get my test back for 10 days, how do you know, right?
Right.
So one of the big things that we're hearing is this national shortage of PPE. Does Tyler have adequate supply of PPE right now?
Yes, we're very fortunate. From day one, we actually activated our disaster plan. So we started performing daily inventory of our PPE, which includes masks, gloves, and different types of masks. We have regular surgical masks, we have regular face masks, the N95 masks that everyone seems to, be becoming very aware of now, and gowns, gloves, things of that nature. So we do a daily inventory, and we look to see how many days out we have supplies for. And we also early on put in a conservation plan, which I think is very important. And we've done that not only in our hospital, but our system hospitals. And we report on a daily basis how much PPE we actually have. So again, we're very fortunate that we do have enough PPE. We've had additional assistance, and I'd like to thank the Wyoming County EMA, who's been very good to us and helping us to access additional PPE when we need it. Some of the area businesses have also donated PPE to us, Cabot Oil, P&G, and we also received some private donations. So we're very fortunate that we are covered and we don't have the shortage here at Tyler.
Great, thank you. And Jean, I'm going to kind of go to you with the same question. So how do you feel about the supply of PPE in Wyoming County as a whole? And do we have enough to meet, again, the healthcare needs? So not just the hospital, but also our nursing homes and our emergency medical teams that are out there, perhaps coming in contact with this when they might be picking up someone who's in a respiratory distress situation. Okay, you go.
We're doing okay with our PPE. We work with their 10 county task force, so we were able to gain some supplies from them. We did have supplies from our pandemic plan that was here. We were able to access PPE from FEMA, and initially to get started, it was the big push to get all of our EMS personnel in Wyoming County supplied with the PPE. I mean, they get called to an incident, and me as an EMT as well and first responder, you don't know what you're walking into. So our EMS teams went ahead and put together their universal protection plan with N95s, gloves, gowns. We ran short of gowns very early on, doubled back, and we have supplied everybody with Tyvek suit. So, you know, PPE is, I don't want to say PPE is plentiful, but we can, you know, we can sustain operations here for probably a couple more weeks with masks, masks, gloves, and that kind of PPE. So, yeah, we're doing okay. We did supply some PPE to the healthcare providers out there, like Dr. Murray's office, like Dr. Williams. They were short on PPE, so we were able to supply that. We're doing okay, and I think that we can sustain that for a while.
Great. Well, we appreciate that, and I know early on, Jean, that you did step in and help a lot of our area nursing homes who felt they were running short as well. So we appreciate you being on top of this with PEMA and requesting those PPE supplies from them early on. So thank you for that.
You're welcome.
Let's get back to some questions here. Anne Marie, what should you do if you have symptoms of COVID-19?
First of all, COVID-19 is a virus, just like other viruses that we've had in previous years. Unfortunately, in previous years, we've identified vaccines that help to prevent the spread of the virus. Unfortunately, coronavirus or COVID-19 does not have a vaccine at this point. So that's why we're seeing a lot of the spread of it. So what we need to do is do prevention. But the typical symptoms, as I said before, are cough, shortness of breath, fever, over 100. But again, we're finding different manifestations of this as we progress on, such as the abdominal pain, the GI symptoms, and something as simple as the loss of taste or smell. If you do have those symptoms, what we're recommending is that you protect yourself and protect others by self-quarantining to avoid the spread of the virus. Everyone's response seems to be very different. We go from, again, patients being asymptomatic to severely ill. So we need to monitor and treat your symptoms, even in the interim while you're waiting for your testing to come back. We need to treat your symptoms. So my recommendation is to call your PCP, your primary care provider, physician, for direction on how to care for your individualized symptoms, because everyone seems to be different. Some physicians now are using telemedicine, so you want to call their office and find out if they're using telemedicine. Some are just using phone visits and they can get advice that way. Some are using their computer to do virtual visits. We've found that that's been very effective. So find out if your own primary care physician is using virtual visits. That's been very effective. If you need help, please contact us here at the hospital and we can get that information to you so that you can get a virtual visit. But the key here is that everyone needs to know if you really need to come to the hospital, if you're experiencing symptoms of severe shortness of breath, any chest pain, anything that's really out of the ordinary that is really causing you great discomfort, do not wait. We're seeing a lot of people that are waiting until they're really severely ill. So be aware of how you are individually. If you're fine staying home and you feel like you can get through it, but if you really feel that you're sick and you can't, you need to come to the hospital, please know we're providing a safe environment here. We've taken all the precautions that we need to prevent spread within our providers, within our patients, and it is a safe place to come. Do not wait. Make sure you're getting emergency help right away if you're really experiencing the severe respiratory abdominal pain or chest pain symptoms. We're here for you.
Now, Anne Marie, I want to go back to that for just a moment because a lot of people feel like the message is mixed, right? We're hearing from the governor that not enough tests are being performed locally, but then we're also hearing that much of the symptoms of the virus can be treated at home. So for me, if I don't feel sick enough, right, to go to the hospital, I'm not going to go and get tested. What is your recommendation there? If I do feel or someone I know has some respiratory symptoms, maybe some GI symptoms, should I contact my primary care doctor to ask to be tested in that instance? Again, we're hearing that we don't have enough people tested, so they don't feel comfortable opening up our area. That concerns me.
Right. And actually, what I'd recommend is to reach out to your primary care physician and ask them, should you be tested? One of my concerns is a false sense of security, because people may come back with a negative test. Just because you have a negative test doesn't mean that you can't get exposed the very next day or the very same day that you have had the test. So again, you still need to take the precautions. In order to seek treatment, it's basically the symptoms that we're treating. So my thought for the day really is, if you're experiencing symptoms that are so severe that you feel you can't handle at home, you need to get to the hospital, to the emergency department. Other than that, you can contact your primary care physician to get guidance from them, because it is so individualized that they will give you the appropriate guidance. We are testing more people now than we did originally when we first started. So the tests are more abundant, and that's why I think you're seeing some of the increases in the cases that we're seeing in Wyoming County. But there's several different reasons. But again, if you have symptoms, don't hesitate to call your primary care physician. Don't get in the car and go there, but call their office, and they will give you the guidance on as far as whether you need the testing, that your symptoms are reflective of symptoms of COVID.
Thank you for that. And you actually kind of answered our next question as well. I'm sorry, did I interrupt you?
No, I just want to make sure I'm clear. If you have any clarification, please don't hesitate to ask.
Sure. No, I think that was very clear, and that was kind of exactly what I was asking. And my next question kind of led into, and I think you already answered this, is, we have seen a spike or an increase in cases in Wyoming County recently, and you kind of contributed that to the increase in testing that has been happening lately. So I think that's kind of a good and bad correlation, I guess. But I think I think again we are going to see a little bit of an increase before we see this kind of go away.
Right. And the other thing I wanted to add too, they just added the testing for people down at Mohegan Sun. Just because people are getting tested down in Luzerne County, the test is actually reflected in the county where they live. So even if you go to Luzerne County or Lackawanna County for testing, your results will come back to the county where you live. So that's important to know as well.
And same thing with that negative test count, correct? So if I go to Lackawanna County or Luzerne County and I get tested and it's a negative test, that number is reported in Wyoming County numbers as well.
Correct.
Okay.
Correct.
And that's good to know, because I think people are seeing a lot of loved ones that they know going other places for testing, and I think that is causing some confusion.
Right.
Anne-Marie, along the lines of taking care of patients, you mentioned patients are waiting until they're in severe respiratory distress. And we're hearing again about this national shortage of ventilators and other equipment. Is Tyler Hospital prepared for patients that are experiencing respiratory distress?
My answer to that is yes. But we evaluate everybody on an individualized basis. We determine most times from their emergency department visit whether it's something that we can care for here at Tyler or it's beyond our scope that the patients may need like a specialist care, such as a pulmonary specialist, sometimes an infectious disease specialist, because their symptoms are that they're exhibiting are beyond what we really can take care of here. But to date, well, I can tell you we're on day 54. We've activated our disaster plan. We're on day 54 of our incident command. And every day, sometimes even throughout the day, we may make a plan and we have to change it. Things are changing very fast. It's very fluid. And I have to commend our staff because they've been excellent in adapting to the new normal of what we're seeing right now. We do treat our patients. We have isolation rooms and negative pressure rooms in our emergency department and our inpatient units, and we have the appropriate supplies and equipment. We do have enough ventilators right now for any patients that do come here. And again, as I said, if patients' condition warrant, we do need to transfer. We don't want to keep somebody here if they need a higher level of care, such as specialty consult. We've been working on telemedicine to get consults here, but in all actuality, we would want to do that as a last resort because the best way to take care of patients is to have the specialist right in contact with the patients. And I just have some resources here to date, just so that you know, we have treated 9 COVID patients, or what we call either positive COVID or PUI patients, which are patients under investigation as an inpatient. We've transferred 11 and we've had 7 discharges. So, so you can see it ranges, and it's basically individualized care. If we feel that you're appropriate to stay here at Tyler, yes, we definitely can take care of you or your loved ones. If it's beyond our scope of care, we don't want to waste any time or delay any care. Our goal is to provide the best care to every patient every time, and that's what I feel we do when we make these difficult decisions.
Thank you, Anne Marie. I appreciate that. And we have a question coming in through the chat. What's the process at Tyler Hospital for patients who have a non-COVID-19 related healthcare emergency?
Again, they need to know they're coming into a safe environment. All of our staff have been well-versed, from our nursing staff to our physicians to our housekeeping staff, respiratory, well-versed on the precautions so that we're not the spreaders of the COVID-19 virus. But if you have a medical emergency, again, as I mentioned before, chest pain, shortness of breath, stroke symptoms, anything of that nature, excessive abdominal pain that, you know, could be emergency surgery, it could be appendicitis, please know that we're here 24 hours a day and we will take care of you. And we will make sure you get the best care in our emergency department. And again, if we determine that you're within our scope of care, we'll keep you here. If you need a specialty care, such as cardiac surgery or anything like that, we will get you to the appropriate place. Don't hesitate to come to the hospital if you have a true emergency.
I thank you for that. Another question that's coming in, and this may be more appropriate for Jean, so I'm going to hold this one for a little bit, and it's about recovered patients. I think you touched on it briefly, but we're going to hold that because it goes back to the reporting of recovered patients. Anne Marie, if patient has symptoms and again, they think they can recover at home, what has worked best for that self-care at home?
Again, the symptoms vary from benign, minimal symptoms to no symptoms at all, to actually life-threatening symptoms. So again, we recommend quarantining to prevent the spread of the COVID virus. It's important that patients contact their primary care physician just to establish the relationship that, you know what, I think I might have COVID virus, and they can develop an individualized plan of care from there. Again, most physicians are using the telemedicine, so that might be done over the phone or through the internet, but some are actually seeing patients in their office. I have to say we have I've worked a lot of places, and the physicians in this county that I'm working here with at Tyler Hospital, they're probably some of the best physicians that I've ever worked with. and I truly trust their judgment. And if they feel that you need to come to the hospital, they'll give you that advice as well, to seek further emergency treatment. So definitely individualized care based on your own symptoms, and come to the emergency department if it's something you feel you cannot take care of at home.
Thank you. I appreciate that. We're going to move on to Jean with some questions, but Anne Marie, certainly you can unmute your phone and jump in anytime that you feel you have something else to add. Is there anything I didn't cover that you want to add?
I just wanted to go over some of the statistics about the COVID tests that we've been performing here at Tyler. So far, from probably about mid-March up to as of yesterday, we've performed 101 COVID tests. Out of that 101, 6 of them have been positive. I did contact Wyoming County Department of Health yesterday to get the total number of tests that were performed in the county, and she had told me there was 226 tests performed. So out of that 226, we performed 101 of those here at Tyler. The county has reports of 199 negative. So you can see not every patient is getting severely ill. They may just have minor symptoms and they're recovering on their own at home. We've had 27 positives. Out of those positives, the numbers that I gave you before, not all the positives need to be admitted. Again, it's individualized care, but it's a virus, and the key is that it's spread very easily. So we have to take the precautions to keep those numbers low. And I have to commend the people of Wyoming County, the community. They've been taking the precautions. They've been staying home. They've been self-quarantining. They've been doing the social distancing. You see more and more of the people using masks. I think people are aware of hand washing, and it's just really important, despite the fact that, we're moving forward and we will be opening businesses. We cannot lax on any of these things. We need to keep those things first and foremost, and each business, each person has to have their own individualized plan how they're going to accomplish that. It's not just business as usual once they open up. They have to have the precautions in place and make sure that they're enforced if we're to have a successful reopening of our businesses and prevent another closure, because that's one of the things that we definitely don't want. We need to move forward with this.
Thank you, Anne Marie. I really appreciate that, and appreciate you pointing out that we do need to continue to be safe and continue to take the necessary precautions. We just got a question in that I think maybe your conversation with the Department of Health yesterday touched on this, and that is antibody testing being done in our area? So we're hearing a lot about that in the news and in the media about antibody testing. So people who have already had COVID-19 and now have built up antibodies in their system. Can we do that locally, and what would be the reasoning behind having someone tested for these antibodies locally right now?
As I said before, this is a very fluid process and things are changing on a daily basis. The antibody testing is primarily still under investigation, and we're very close to having antibody testing here locally. The antibody testing that has been done has been beneficial because they're identifying how the virus works, whether it can be used for treatment in other patients. Some of the treatment plans that we look at when we do have a positive COVID patient is plasma from patients who have been exposed, who then can help the COVID positive patients develop some immunity. And some of the studies show that that's been effective. So we are getting into a program, the registration for administration of the plasma from the patients who have been exposed. So we really, it's really an important step. It's not the only step. I think the biggest step will be once we get a vaccine approved. But the plasma and the use of the testing for antibodies is key to treatment of this disease.
Thank you. We appreciate that. Jean, I'm going to move to you to ask some questions. And again, Anne Marie, I hope that you'll be able to stay with us on the call. And if you have anything to add, please jump in with us as well.
Sure, thank you.
So, Jean, can you hear me?
Yes.
Okay. Perfect. So, one of the things that many residents of Wyoming County are frustrated with is, we're still in this red zone. And I wanted to talk to you this morning about what guidance you have received from the state regarding reopening procedures and what we need to do to move Wyoming County from red to yellow.
Well, one thing that we need to understand is the reopening is going to be determined by the governor's task force. I know our commissioners sent letters last week asking to be moved from red to yellow. And last Friday, early on, I had some information that said we were going to move to yellow, but then by 2 o'clock, we still stayed in red. So, the state team is the one that's looking at this. They're looking at our cases. They're looking at our neighboring counties and the amount of cases that are in those neighboring counties, and basing their decisions off of that. That it's totally up to the governor and that team to say who goes from red to yellow to green.
Right. And but again, you haven't received any guidance from them other than, again, this basic 6 standards that they're following.
Yeah, that's exactly true.
Okay. Good to know. Has the county identified, so when we do reopen, one of the things that they're talking about is contact tracing and high risk areas. Has the county identified those high risk areas in our community, and what steps are being taken by the county to kind of mitigate that risk?
Right now we're not privileged to all of that information because of the confidentiality pieces of the process. We do know that we do know there's some hot spots up in the northern part of the county, the northeastern part of the county. We do know there's hot spots there. And the tracing part of that, the information that we receive is if there's a positive case goes into one of the facilities, not only in Wyoming County, but in Lackawanna or Luzerne, that they are calling us back saying, hey, you know what, you got a positive case, any EMS crews that were involved with this, you want to notify them and verify that all of the precautions were put in place. And if all precautions were put in place, then they need to self-monitor for 14 days. So our cases have not been isolated to one area. They are scattered throughout Wyoming County, and it might be 1 here, 2 there, 4 here. So it's not like it's a nursing facility or something like that. In fact, I've got to really praise the Gardens, Methodist Manor, and our nursing facilities, because we're not hearing of any cases coming out of there.
That's great. That's great. And we do appreciate them as well, and keeping our loved ones safe. Jean, what are you hearing from other areas that are starting to reopen? What issues are being raised by them? I know you're in contact with your colleagues kind of throughout the state. What things are they looking at?
Well, there was a fear out there, and rightfully so. And I have this same concerns here in Wyoming County. The message is we're reopening, and I think that message is being taken beyond the scope. Yes, we are lifting restrictions in yellow phase. You know, it's not flipping the switch, the lights go on in Wyoming County, and we're all back to what we're used to doing and back to the normal way of living. That's not the case. And I know there's concerns of my colleagues out in the other counties. I mean, yellow is a phase, and under yellow, we need to be very careful in how we move forward. And I gotta agree with Anne Marie. I mean, we can't drop our guard. You know, we still need to social distance. We still need to be using masks. You know, we need to take those precautions so that we don't go back to red. There isn't, you know, if this thing goes bad under yellow, we go back to red. Right. And I don't want to see us going back to red. So the message out there needs to be, let's do this when we get the yellow light, and let's be extremely cautious and careful as we move forward.
Right, and I think that the business owners that have been on our calls, because again, we've been doing these calls 3 times a week on various topics, and we've had, you know, roughly 30 to 40 business owners on these calls at every, you know, 3 times a week. And they do want to be cautious, but what they're running up against right now, Jean, is where do I find PPE that is appropriate for my business? Where do I find the proper cleaning supplies that are going to eliminate this virus off of my surfaces, and that I will feel comfortable cleaning with, and then again inviting my customers into my location when that time comes. Can you give us some guidance on where we can find PPE, again, as business owners and back in the community? What does that look like for us?
That is a great question, because right now we're back ordered on PPE for emergency responders. When I say emergency responders, I'm saying, you know, police departments, fire departments, EMS departments. We're back ordered. And I know the state, and we're looking towards the state to help us with this. Mm-hmm. And these commodities are not readily available at this point. So, you know, I think that business owners need to be looking at the Amazons and those type of outlets to try to, you know, get the supplies that they need.
Right. And I
think we're covered. We're covered here at the EOC. Our EOC has been partially activated since the 16th of March. Mm-hmm. And this is something that we've been working on since then, is to, you know, keep our PPE covered for when the emergencies hit. You know, our people are protected. I understand, and I can feel business owners' pain on, you know, where do I get this stuff? There are homemade disinfectants that can be made with peroxide and alcohol and Clorox and those kind of things. So there are disinfectants that can be made by businesses and appropriate to use. You can find that on the internet.
Right, right. And I would encourage all of you to utilize our local hardware stores. Their supplies are there. They have a supply chain that they are able to get the peroxides, the alcohol, the Clorox, and other sanitizing materials. As far as masks, and again, we've talked about this, and I think I will, Jean, yourself and Anne Marie may be able to help with this one as well. But as far as masks go, the general public and also our businesses and even the workers in those businesses, they do not need N95 masks. they don't even need KN95 masks, correct, for everyday use?
Correct, Gina. In the hospital, I can tell you we're using regular surgical masks for our isolation cases. N95 masks are only used for cases where there's aerosolized treatments, such as our nebulizer treatments that we give to our respiratory patients, or intubations, or anytime that there's like a much higher risk of the droplets getting transmitted to our healthcare providers. So in general, a basic surgical mask is sufficient, and for our community, the homemade masks can be made. The thicker it is toward their mouth and nose, and please make sure that you're covering your mouth and your nose, because I see people with just their mouth covered. The virus can go through your nose as well. But the thicker it is that they can tolerate, the less chance of particles getting through the mask.
And that's very good advice.
Gina, I totally agree. You know, the homemade masks, we're seeing them all over the place. I met up with somebody who's already made like 1,700 of them in Wyoming County. You know, it's a barrier device. It's a protective device. Absolutely, don't be afraid to use a homemade mask.
Great. And I want to let all our business owners know too that the Pennsylvania Chamber has been working on this, and they have put together some great resources. So I think what we're going to talk with them and the resource that they put together on how to find supplies that you'll need next week. So we'll have some advice there, and I will be looking again as a chamber. We will be looking to create a resource locally where, okay, who does have an abundant supply of homemade masks that they're willing to supply to our business community. Also, it looks like there are a few people on here that have some contacts, so I'll be in touch with Richard and look at how we can do group buys for our community with masks and some other sanitary and PPE products. Sorry, I got distracted by reading the chat there. Jean, one of the things, and again, we're talking about this right now, is masks. I see people that are refusing to wear masks, or they're not sick, so they don't, you know, or I'm just running into this place for a minute. How do you suggest business owners handle this when we do move into that yellow phase and more businesses are open and we're seeing more people without masks on? How will that be handled and regulated?
I don't know that there's any regulation to that, but here's something that I want people to understand. This is real. You know, there's people out there that I've met up with like saying, oh, this is just one of the governor's brilliant ideas again. No, it's not. This disease, this situation, this pandemic is real, and it is in Wyoming County. There's just no ands, ifs, or buts about it. We've got registered cases, and it's here. So, you know, people need to get the strong message that when you're out in public, that not only is that mask to protect them, which they think, oh, I'm healthy and you know, I don't need one to protect me. They're not protecting the other person. And that's the part that upsets me a lot, that they need to be thinking of others. And in answer to your question, I mean, I've been to businesses where it says mask required. And you know, people need to follow that direction.
Mm-hmm.
I mean, that needs to be a strong message, I think, not only in Wyoming County, but throughout the other counties, the surrounding counties. This is real.
Right. And
this is no joke.
Right. And I would jump in that as a business owner, you have the right to protect yourself, to protect your staff, and to protect the other customers. So, you know, just like, you know, we've always seen those signs that say no shirt, no shoes, right? So
You got
no
it.
mask, no service. I think
Exactly.
that you as a business owner have the right to deny service if they're not wearing a mask, and you need to stand up for your establishment. Jean, another thing that we've seen recently is the weather's getting better. The weather is getting better, and people are itching to get out of their house, right? So they're gathering, or at least going outside. I've been to the park, and I think people are being very respectful at our local parks and keeping, within their families or within their group that they came with. I assume it's their family and people that they've been, kind of exposed to this whole time. But again, going back to that, what if they're violating or making those community areas and parks unsafe? Is there something that can be done? Again, we hate to police each other, but I think it goes back to being respectful to each other.
Well, and that is totally true. Lake Winola on Sunday was like it was a outdoor gathering, but what I did notice is like there were a lot of boats coming in and a lot of families bringing boats in, not necessarily had masks on, but the social distancing was totally in place. A lot of people fishing, along the edges of the shore, and I noticed that the social distancing was in place. Yes, we need to be respectful for each other. I mean, the weather's getting nice. People have been cooped up way too long,
Yeah.
and they're ready to get out. They're ready to go do things. And my suggestion is, if you go somewhere and you see a group that is a group of 10 or so that could possibly be family, just stay away from that group. And if we see a big, large gathering, I haven't had to deal with that or haven't had complaints here in our office yet. But law enforcement, I believe, does have some authority to work with that group and make it somewhat safe.
Yes, I believe so. And one of the things that just came in was they would ask that EMA and the county commissioners issue a statement regarding masks for local guidance. And I think that statement is already pretty clear, right? So the governor's statewide statement is everyone should be wearing a mask. If you're out in public in a confined area, I would agree. I don't think we necessarily need to be wearing a mask if we're out at the park. But if we're going to the grocery store or inside another building, we need to have our masks on. And Jean, is that the statement kind of from EMA of Wyoming County and from our commissioners?
Wyoming County is following the direction of CDC and the Department of Health. That's the direction we're following, and to try to move laterally from that would be, not a smart idea. I mean, they've supplied the guidance, and all we got to do is follow that guidance. But yes, when you're out in public, you need to be masked up. I mean, I'm going for groceries tonight. Guess what? I'm wearing a mask.
Mm-hmm. And I think people are respectful of that, and I know that certain grocery stores have people right at the door making sure that their customers are wearing that mask. So
absolutely.
Again, I thank you. I think we've covered a lot today, and I think that this was such a great topic. We've kept you on the phone for nearly an hour, but there are many, many questions in our community as they relate to emergency services and our health. And if you all don't mind, I would love to have you be a guest on our series again soon. We are moving our series into what we're calling the rebound phase. On Friday, we have Senator Lisa Baker, so she's going to talk to us about, what's happening statewide and how we can help Wyoming County move into the yellow and some concerns that we've all had about still kind of sitting in this red phase. But again, I think we need to be ready to move to the yellow, and I see a lot of concerned business owners here who are still finding the PPE and getting their stores ready to move. So we will do that together. And then again, our rebound phase will start Monday, May 11th. In our rebound phase, we're looking at this a little bit differently. So we've been doing broad topics that relate to all industries each Monday and Wednesday, and then Friday we've been recapping. What we're going to do moving into our rebound phase is you'll see on Mondays that we have some specific industry discussions. So on Monday, May 11th, we are going to talk with the Pennsylvania Restaurant and Lodging Association about questions that relate specifically to restaurant and lodging industry. And then we'll touch on some other industries as we go through this process. Again, this is a fluid series. So if you have topics or as topics come up that we need to discuss, you know, Anne Marie and Jean were so gracious in getting on the call with us today. This was not a planned call originally in our schedule, but I think this was a very important and much needed call. And I think that I truly appreciate the time that they spent with us, and I think that they answered a lot of questions that I had personally, but I know that our business community had as well. Be safe out there, everyone. Please protect your families. Jean and Anne-Marie, I'm going to let you have a last word. So if you have anything you would like to share, Jean, if you want to just share a last thought with the community here while we have everybody on the phone.
Sure. We want to see our county reopen. There's no question about that. And we want to see our businesses get back to some type of normalcy and get back in business. The only thing that I need to express is we just need to be careful in how we do that. You know, this thing can go rampant on us at any given time. I use an example: when we get called out to a hazardous material spill, we can see the material, we can smell the material, we can mitigate the material, we can clean it up and go home. This particular situation that we're in, we can't see it, smell it, taste it, and we don't know where it is. So we have to be extremely careful and cautious moving forward. I can't wait until the day it is I can take my wife and go to a restaurant and have dinner like I used to. So, you know, and I know patients are running thin, but we got to do this and do this very carefully and make sense of it as we go.
Thank you, Jean. Anne Marie, do you have last words for the community?
I totally agree with Jean. This is something that is not going to go away on its own. It's something that we need to take responsibility and take the precautions that we need to right now. So this is an opportunity for all of our business. As I know, we at the hospital, we're planning on reopening some of our elective cases. We have to do it slow, and we have to do it the right way. So I'm asking all of the members of our community and all the business, now is the time to make sure you have a plan in place. It may have to change a little bit later on based on things that come up, but we have a self-responsibility to ourselves, our other community members, and our families. So please take the precautions that you need to so that we can reopen responsibly and we can reopen to a safe environment going forward. And my best to everyone, and use the resources that Gina has put out there. The Chamber has done an excellent job in providing resources. Please use them. Don't hesitate to reach out or call your other resources. Network with people to see what they're doing. You're not in this alone. We're all in this together. So thanks a lot for this opportunity, Gina.
Gina, one more thing for me. If there's any questions for our office, please feel free to give us a call. Yeah, resources, whatever. You can get our office at 836-2828. You know, feel free to reach out. And if we don't have an answer to your question, we'll definitely try to get one.
Great. And I want to thank Jean and Anne Marie again personally. They have been in touch with me every step of the way. I called them before we canceled our very first event back on March 18th when I was supposed to have the congressman come to Wyoming County. I spoke to both of them the day before I made that call, and they've been with me every step of the way in making the decisions that the chambers made, and then again in helping our county to move through this pandemic. So thank you both for your expertise, your time, and your guidance. We truly appreciate it. The Chamber will be developing more resources. The PA Chamber has a great tool called Bringing Back PA, and we're going to walk through that on our May 13th call. We will, we are looking at some documents that other states have provided to their business community to help them set guidelines for their staff and for cleaning and just some policies around reopening. So I know that was a question in the chat. We will get all of that information out to you on our website as soon as we can filter through it and again develop those tools and resources for you. We do have posters available out there if you'd like to print posters to hang in your store. And again, you should be training your staff on how to properly wear a mask and clean and things like that we've talked about several times. Thank you all for your time today, your patience, and we will get through this together. We're here for you. If you have questions, please don't hesitate to call me. The chamber phone number 570-836-7755. That transfers right to my cell phone, so you can get me even though we are working from home. Thank you so much all, and have a great day. Stay safe.